Hi Cindy, you've recently published a paper on lower extremity arterial disease. Can you tell us more about this?
Yes, of course. This paper concerned patients with lower extremity arterial disease, also known as lower limb peripheral artery disease. This is the third most common clinical manifestation of atherosclerosis and affect over 200 million people worldwide. Additionally, it's associated with very high risk for adverse cardiovascular events.
Oh wow, that sounds serious. How do you find out you have lower extremity arterial disease?
That's exactly what we want to explore in our study. Previous studies have shown that women with lower extremity arterial disease have different symptoms and are often underdiagnosed. Therefore, we wanted to explore whether at the level of the GP there are already differences between men and women in the number of visits and the reasons for visiting.
Oh cool, how have you done this?
We use a region-wide registry to compare patients with lower extremity arterial disease with a reference group of the general population. Within these two groups, we investigate the differences in GP visits between men and women.
Oh nice, and what were the results?
We identified over 4,000 participants with lower extremity artery disease and include over 10,000 participants from the general population. In the lower extremity artery disease group, the number of GP contacts was higher in women compared with men, 2.7 versus 2.5. We saw a small increase 1 month before diagnosis in GP visits, but this was not significantly different for men and women. Also, the main reason for GP visits was cardiovascular problems followed by endocrine and musculoskeletal disorders. Therefore, we conclude that women with lower extremity artery disease have a higher frequency to be asymptomatic or present with atypical leg symptoms. These factors could contribute to a delay in diagnosis and worse prognosis. With our study, we conclude nevertheless it is unlikely that the worst prognosis in women with lower extremity artery disease is due to a delay in diagnosis by the GP.
Thank you Cindy, I very much look forward to your next study then.
Thank you, Robin, and we will definitely continue to turn the last stand on this subject.
Created using Powtoon.